Welcome back. How are you? I'm the Dr. Bob Lee. Hey, our next guest is the Associate Director of Care Management for CABS Health Network, and she joins us to highlight the home care services that CABS has to offer and so much more. She's here with all the information, so please give her a warm welcome, Andrea Kiliaris. Welcome, welcome, welcome.
Hi.
Did I say it right? Kiliaris?
You got it. You got it. I'm not going to kill you this time.
You're not gonna Kiliaris me, right? But listen,
Thank you for
tell us
having
more
me.
about your organization and what it's all about. This is your first time on Open?
Yes, yes, it is. So I'm glad to be here. Thank you for having me.
Hmm.
Um, CABS is more than home care. CABS is a health network. It is a trusted, comprehensive provider of home care services, but also provides community health solutions that are dedicated to enhancing quality of life for individuals and families, helping folks stay connected to care, right? For over 40 years, CABS has empowered clients to live healthier, safer, more independent lives by focusing on compassionate care,
Yeah. And
professionalism, innovative support systems. CABS is deeply rooted. Yes.
I thought you froze for a hot second there. Um,
Oh, I'm sorry.
I got that. So cabs and care management is something different, or is it part of the same thing?
So it's part of the same organization. CAB services are not only home care. Our CEO, Ms. Shirley DeMossany Atkinson, in 2017,
Uh-huh.
wanted to take CAB's home care to the next level, wanted to broaden the legacy of the organization to not only provide services to folks through home care, but also actively engaging with the community in initiatives to promote overall well being, access to quality health care, and helping create programs that really serve to educate the community, provide screening for what are folks eligible for. Knowledge is power, right?
Uh-huh.
In New York City, a lot of New Yorkers don't know what they're able to access. They don't know what they may be eligible for. So care management helps folks get screened and navigated to appropriate services to
Mm.
provide them with a level of care that keeps them healthy in their home and community environments. Right? No one wants to be in a hospital.
No, no. And who qualifies? I mean, how do you get involved with your organization?
So to get involved with our organization, you have to have active Medicaid, right? Active New York City Medicaid. You've got to
Uh-huh.
have a need for services. You've got to have some chronic medical conditions. You've got to be able to want the services. It's voluntary, so no one's forced to get enrolled in the program or to receive the services. But
Uh-huh.
you've got to want the services. You've got to be able to have chronic medical conditions that sometimes are unmanaged, maybe unstable, and you've got a need for someone to help you navigate how to become healthy and stable around your chronic conditions. And there are services that you
Yeah.
may not even know you're eligible for.
Yeah.
Right?
I mean, that's
You may
important to have somebody walk by your side letting you know that, hey, you have this situation, but here's how you can get out of it, or here's how we can
abs-
help you in a better way.
absolutely.
Yeah.
A lot of folks, there's community stigma, right? There's cultural stigma. Us being in New York City, we're a melting pot. Folks may not know that they have an undiagnosed mental health condition. How do we get that individual connected to care? How do we get that individual connected to care in a way that's safe?
Yeah.
Folks sometimes are jaded by systems, right? New York City is a tough place. It's the concrete jungle, but it's also a lot of services, and the folks that we serve may not know how to better access those services and what makes a particular service different over the next.
Excellent. And what makes care management unique?
Care management is unique because in a nutshell, it really helps you identify what are you eligible for, right? I may not know that I can get transportation to my appointments. I may be struggling to become stable in my conditions because I can't get to the doctor. I don't know how to get there. I'm afraid of getting there, right? We've got a lot of folks who are afraid of traveling on the subway system or traveling in public. How do we get folks escorted to their appointments? How do we get folks connected to care via transportation services? How do
Hmm.
we get folks integrated pest management services, right? One of our care management programs works with kids who have asthma related to allergens to pests in the home.
Yeah.
And that is exacerbated, right? They've got multiple hospitalizations. The family can't figure out what's going on. We do an assessment. We figure out there's a pest allergen. We can help folks get connected to integrated pest management services. And now this kid, a year later, hasn't had any hospitalizations related to that allergen.
Wow. Took all
Yeah.
the dust out of the house, vacuum that dog, or do something with the dog. Get maybe, well, you can't have pets, right?
Well, and specifically pests as well. So there's allergens to mice, roaches, etc. And those can be eliminated with integrated pest management services.
Yeah, yeah,
And that helps to eliminate the allergens that the kids that we serve face.
that's true.
There's a
That's
lot of
great.
stigma in helping folks know what they can receive and helping them get connected. A lot of New Yorkers, like I mentioned before, are jaded by systems, right? They're like, what makes you different? I've been through the system. I've been around so long, nobody can help me. Let's do an individualized needs assessment. Let's really break it down. And you're not identified just by your diagnosis. You're not just a label. You're not just a number. You
Yeah,
are an individual that has needs.
yeah.
And those needs can help, once they're met, help you be stable. We want you in your home and community. We don't want you visiting hospitals, long-term care facilities. We want you to get that good quality care so that you're living a healthier and safer, more independent life.
And they got the right person for the job to explain it and get the word out and create the awareness. You're
Thank you.
doing a fantastic job doing it. You seem so sincere,
Thank you.
and you need a person like that to maybe get that message across to people.
Yeah.
How can people get in touch with you and CABS?
Sure, sure. I just wanted to tell you a quick client story when you mentioned about the sincerity and how it is to connect to folks because,
Yeah,
early on in my career, I didn't always know how to help folks, right? I was a social worker. I went out and I said, I've got to help people. I
yeah.
didn't always know. And sometimes when we say that we understand, we don't actually understand, right? And I had a client hand it to me when I turned to him and said, "Oh, I
Putting it
understand what
nicely,
that's
right?
like." Right? No, you don't understand what that's like. So
Yes.
I think what makes us as an organization and the program unique is that we don't understand what every individual is going through, but we want to hear. I will
But
never
that's
tell you
important
what
right there too. That's important if
know.
you can sit and listen, because that's a big part of it also. Sit
Yeah,
and listen to somebody. Sometimes just people just want you to hear them out.
yeah.
You know.
Just tell us what you've got. And you can do so by going onto our website, right?
Hmm.
CABShealthNetwork.org. You can reach out, you can put an inquiry on the website. We're able to come out to community events, churches, social gatherings. We really want to educate the public and we want to make ourselves available to the public to be able to access services and help provide them that information.
Yeah.
Our phone number is 718-388-0220. I can be
Yeah.
reached at extension 345. My email, akiliaris@cabshomecare.org. I'm here, ready, willing, and able to listen to help provide the support that folks may want or need without knowing that
Yeah.
they need it sometimes.
Yeah. And it's all about creating a relationship. If
Yes,
you can sit and listen to somebody, that's the starting point of creating that relationship. We even do it in
absolutely.
radio too. I'm
Absolutely.
out in the community. I want to hear what you have to say, and they'll talk about it too. Oh wow, that
Mhm.
organization, they were interested in what I had to say. They gave me
Yes,
the minute. They gave me a minute of their time, and I know how
ab-
busy they are. But when
absolutely.
you can do that, that's the start. That's the beginning of the relationship.
Yes. And that relationship is what carries folks forward and helps folks want to get the care that they need, right?
Yeah,
Because if you don't feel connected, you don't feel like you're really being helped, you're not going to go out there and go to the doctor.
that's right.
Folks who may not have their basic needs met, folks who may not be stably housed.
Hmm.
Housing's a big issue in New York City. They won't have a place to store their medication at night. So how do I expect them to be well when they don't have a place to store their medication? So let's figure out, how do we A, get that medication, B, help you store it, and B and C, help you apply for what you may be eligible for. We can't guarantee anything, right? But what we can guarantee is help.
people listening to you right now and watching you, they're saying, wow, I would like to be a part of that organization. Are you located in New York City or in the
Yeah.
tri-state area or
So we
5
serve all of New
boroughs?
York City. Yes, we serve all of New York City, and we're located in Brooklyn. We're located on Flushing Avenue
All
over
right,
in Brooklyn. Yeah.
there you go. Where can people go to learn more about the CABS and Healthcare Network?
So you can go to our website. You can reach out. Reach out to me. I'm happy to come talk about our services, come talk about programs, help folks get screened and navigated. I've got an amazing team of talented care managers, patient navigators, community healthcare workers. We've got folks who actually really care about the work and they're ready, willing, and able to come to you. We want to meet our clients where they are, literally.
Oh, that's it.
Yeah,
That's how you do it. You guys know what you're doing.
that's it.
Excellent.
Thank you.
Listen, thank you for coming on and sharing, and thank you for all that you're doing in our community to help
Thank you
others.
so much. Thank you. It was a pleasure to be here.
Yes. What's that number again? Where people?
718-388-0220.
Wait,
My
I'm
direct.
writing it down.
You
Look, I'm
write
having
that
you say it
down,
again.
Dr. Call.
718
388
388
0220.
0220. Got it. Well, thank you so much.
Thank
Andrea
you.
Kiliaris, Associate Director of Care Management, CABS Health Network. We appreciate you and thank you for coming on.
Thank you for having me.
And you got to come back again, okay?
For sure, you got it.
You're always welcome. All right, we'll take a quick break. More open coming up next.